Well, my name is Paul Fogelberg, and I'm the volunteer director of the Pulmonary Fibrosis Advocates, which is based in Minneapolis, Minnesota, but with offices also in Washington, D.C. And it's a pleasure for me to be in Richmond, Virginia today to talk to the Breathe Matters support group about the Pulmonary Fibrosis Research Enhancement Act, also commonly known as PEFRA. It's House Bill H.R. 2505 and Senate Bill 1350. What we're trying to do in the 112th session of Congress is pass this legislation which would very simply and inexpensively create a national pulmonary fibrosis patient surveillance registry. That's a long phrase, but what it is an essential tool that would both speed up existing research into the cause of pulmonary fibrosis and launch new research efforts. Pulmonary fibrosis is a disease that estimated now 200,000 Americans suffer from. There's no treatment for it, there's no cure for it. 80% of patients who get pulmonary fibrosis die within 5 years of diagnosis. The prevalence of the disease is up 150% since 2001. As the baby boomer generation ages, the disease is becoming much more prevalent. Today we lose a pulmonary fibrosis patient about every 13 minutes, or roughly 40,000 deaths per year. For a disease to not have a treatment or a cure that has a lethality that's that extreme is what fuels patient advocates like myself and many hundreds of others in other states throughout the country to do the work that we're doing to pass this legislation. I'm happy to speak with the Breathe Matters support group in Richmond because what we're here to do is to educate a little bit and to recruit new advocates. Congressmen and senators like to hear from their constituents. And so the letters and the emails, the telephone calls that they get to the Virginia congressional delegation for this legislation will make a meaningful, positive difference in the passage of the bill. We're hopeful for a cure, as people with any disease are hopeful for a cure. Right now, what we're trying to do with legislative advocacy is pass this legislation to provide one simple tool that will give researchers the information that they need to find an answer to the question of pulmonary fibrosis. So what we've encouraged everyone here in the room today to do is to send an email, write a letter, make a telephone call to each of the 11 members of the Virginia congressional delegation that are not yet co-sponsors of the Pulmonary Fibrosis Research Enhancement Act. Delightful to be here, and we're an advocacy resource that is available to anybody in the United States 7 days a week, 24 hours a day. So you can call 800-229-2531, or you can go to our website at pfadvocates.org and use the link there to send a message to your congressman or your senator. Thanks very much.
Great honor to be here. Ooh, that sounds loud. My name is Paul Fogelberg, and I'm first and foremost a pulmonary fibrosis patient. I was diagnosed February 4th, 2006 at 4 o'clock in the afternoon, not that I'm counting, and was, like those of you who have a lung problem, stunned that in 2006 or 2012 that I could get a medical condition that was idiopathic. That the doctor was a delightful gentleman who's become a good friend, said, you know, God bless you, there's nothing I can do for you. So good luck with that. We'll give you some drugs. Actually, there's a slide coming up later where a couple of my dogs are on the slide, and he said, "Do you have a dog?" I said, "Yes, of course." "How many times a day do you walk it?" I said, "I don't know, twice." He said, "Well, you should do it more often, because the exercise will be good for both of you." And that, frankly, was the best prognosis he could give me, was that I would do better as a pulmonary fibrosis patient if I just exercised more. And so I had one dog then, now I have 4. I get a lot of exercise. I started out, maybe like many of you, on the internet, trying to read about disease, learn something, educate myself. I'm a lawyer by training. Many people think of that as my first and biggest disability. But I knew absolutely nothing about pulmonary fibrosis. So I began to dig in, and I discovered the websites of the Pulmonary Fibrosis Foundation and the Coalition for Pulmonary Fibrosis. I'm not really comfortable as a public speaker, but I'm also not shy in retiring. As a consumer, I'm kind of an aggressive guy, so I got involved with the Coalition of Pulmonary Fibrosis literally by an appointment, picking one organization. They were based in San Jose, California. And in my very young life, I graduated from college and got a job working at Pillsbury for the Doughboy as a lobbyist in Washington, D.C., lobbying food policy issues in Congress. When I left Pillsbury, I went to law school and continued to do the lobbying work for a variety of different causes. So I became, to the Coalition for Pulmonary Fibrosis, I was the first pulmonary fibrosis patient they met who actually had some Washington, D.C. experience. Back in, that'd be 2007, there was one member of Congress who had pulmonary fibrosis. His name was Charlie Norwood, who was a member of the House of Representatives from Athens, Georgia. Very conservative Republican guy, but Charlie was so sick that he really was not effective as an advocate for the disease the remaining months that he had before he passed away. He, however, introduced us to 2 other gentlemen on Capitol Hill, Brian Baird from Washington State, a representative, member of the House from Washington State, and from Mike Castle from Delaware. Brian's father died of pulmonary fibrosis. Mike Castle's brother has died of pulmonary fibrosis. So they were somewhat knowledgeable and certainly well motivated to help. We embarked on a mission to figure out what researchers needed to move the ball forward. And I've told this story so many times, I never know how much detail to put in, so you can stop me and interrupt me at any time, ask me questions at any time. I should have said that at the very beginning. But we went first to the National Institutes for Health and said, really people, you're not spending very much money on pulmonary fibrosis. Why is that? And they said, well, there aren't enough people applying for grants. It's literally a chicken and the egg theory. So how are we going to get more people to apply for grants? Well, we don't have a patient database. There are many, all of you are being treated by a pulmonary group. So they have a database of their patients. Sometimes in a hospital like this one, this hospital will have a database of their patients. But there is no, well, there's one state pulmonary fibrosis patient database in Pennsylvania, but there's no national effort to collect the information. So that's what we set out to do, and introduce a bill to make that happen. In addition to Breath Matters, there are 75 pulmonary fibrosis support groups in 34 states. And there is the Coalition for Pulmonary Fibrosis in California, and there's the Pulmonary Fibrosis Foundation. And Peter has a fabulous website, IPF Today.
I had a particular problem as an aggressive advocate that I found a law firm in Washington, D.C., Holland and Knight, to help us with the lobbying effort. They needed a bona fide nonprofit organization, a 501c3 or c4, to be a client so that they could provide us with legal representation for free, pro bono. The Coalition for Pulmonary Fibrosis and the Pulmonary Fibrosis Foundation were not interested. So being a lawyer and sort of knowing how to do it, it made it fairly easy for me, and in 15 minutes I incorporated the Pulmonary Fibrosis Advocates. And we work with support groups in other states. We work with the coalition, we work with the foundation to try to move the ball forward in Washington. My personal motivation that's two of my three daughters, and my wife is in the middle. Sarah's really mad that I didn't come up with a picture that includes her. About 20% of the cases of pulmonary fibrosis are called familial or genetic. So there is a 20% possibility that one of my daughters can have this same diagnosis. So that's a very personal motivation for me. I don't want them to have the delightful Dr. Mickman standing at my bedside saying, you have a terrible disease and there's nothing I can do for it. So on we go. Since I became involved as an advocate, I've got a lot of friends. I've met a lot of friends, and delightful to meet a bunch of you today. Lisa Spade Sandler Spade was one of the first I met, 43 years old, diagnosed with idiopathic pulmonary fibrosis in September of 2006 and died in May of 2007. 2 kids. Her father, Jerry, is a retired general surgeon, and her mother has become my surrogate Jewish mother. Everybody should have one of those. Rome is terrific. Greg Chandler and Guy Solano are Cindy Chandler's husband and father, both deceased from pulmonary fibrosis. So Cindy's doing the best she can as a widow, and she's got 2 sons who are growing up without a father. William Baird is the father of Representative Baird. Passed away in 2007. And Brian has 2 sons, so he's got 2 grandsons, William Baird, who are growing up without their grandfather. Charlie Norwood, we've already talked a little bit about. He's gone. Literally tens of thousands, really hundreds of thousands more. So I felt a personal sense of obligation. Since I'm coping better with the disease than many, I happen to be in the 20% that don't have a rapid decline with this disease, that I needed to use whatever skills I had. Advocacy really being the only one that I'm good at, to give voice to those people who deserve to have somebody talking about it.